Hi, Mike Erlob here, back pain specialist for over 22 years, and in this educational video today, I'd like to talk to you about what is degenerative disc disease. We're going to talk about what it is, we're going to talk about what patients feel, we're going to talk about treatments that don't work, we're going to talk about the treatments that do work, what the solution is, and we're going to talk a little bit about how the role of nutrition plays in the degenerative disc disease. So let's get started. What is degenerative disc disease? That is when the discs of the spine start to wear out. Now you see the vertebral bodies, which are just the bones of the spine. You have these discs that are made of mainly cartilage, and then they have kind of a jelly material in the center, which helps provide the cushion. So it provides the cushion and support to the vertebrae, helps space them apart, keeps room for the nerve roots so they can stay nice and healthy. Well, what happens is through compression and wearing out of those discs, they get squeezed down and they become dehydrated, they start to crack, they start to bulge, they can actually herniate, but they just in general start wearing out. You lose the height or spacing between the vertebrae, and then that actually will start to compress or pinch on the nerves and creates all kinds of pain. Now, most patients will start to feel a pain in their central low back that often progresses into pain that wraps around to the front of the hips, pain that goes down the legs. It increases with standing and walking, lifting activities. Many of my clients just can't sleep through the night. This also limits their ability to be able to go shopping, do yard work, do housework. Many times my clients have had to stop working out. They can't run or do any of those impact type of activities. Many times they get up in the morning and they feel so stiff and sore, it takes them 5 or 10 minutes just to loosen up. It starts making them feel like they're old before their time. They can't be there for their family and friends, and this just leads to a lot of frustration and fear that they're just gradually losing their edge and losing control of their life. Now, most of the conventional treatments out there for this condition just simply don't work. They only provide a short-term relief. Things like, massage, chiropractic care, ultrasound, electrical stimulation, acupuncture, medications, even injections, ointments, hot packs, cold packs, those things just don't work. They may give a person some short-term relief, but they don't work because they're not addressing the root cause of the problem. So many people think the root cause of the problem is the discs, but I'm here to tell you that is not the root cause of the problem. You see, the wearing out of the discs is just a symptom of a greater problem. The root cause is the imbalances that have occurred in through the hips and the lower back. And what I'm talking about is the thigh bone or the femur, which comes out of the pelvis, the hip joint, will start to lose mobility of the hips. And this occurs because one of the hip flexors, called the psoas muscle, which actually originates off of the vertebral body of the lumbar spine and comes through the abdominal area, through the groin, and attaches to the femur, it will start to shorten and become spasmed. And it does this because of repetitive sitting, too much sitting, repetitive job tasks, too much movement in the same direction all the time. All of that causes that to tighten up. And then as it does it, that creates a pull on the lumbar spine, which creates compression. So it's just like somebody grabbing the spine and pulling forward. That compresses and squeezes these discs down, which just causes them to degenerate faster. And then what happens is the muscles on the back side, they'll start to spasm and lock up. You'll get weakening of the gluteal muscles, weakening of the lower abdominals, and all of that creates an imbalance, which leads to pain, irritation, inflammation, and degeneration of those discs. So you fix this problem by normalizing the activity of the psoas muscle, regaining the mobility of the hips, increasing the activity of the gluteal muscles and the lower abdominals to balance out that entire system. So now the discs can stay hydrated and healthy. Also, nutrition plays a key role. And you see, today, most of us tend to, we take in too much sugar and too many carbs. This causes your body to become more acidic. You see, if your blood pH is below a 7.4, you are starting to become acidic. And chronic inflammation and deterioration increases when your body is more acidic, and this includes your discs. So learning how to alkalize your body is really key. Limiting your sugar and carb intake and staying hydrated with plenty of water throughout the day. Don't allow yourself to get dehydrated. Those are key points which really will help keep your discs healthy. If any of this meant anything to you or you found it to be helpful, please like, comment, and share this with your family and friends. And until then, I'll see you soon.